So today I wanted to be able to share with you guys a little bit more about Labrador tea. um, but we did the cedar tea the other day, and now I want to spend some time and really discuss the importance of Labrador tea, Leadum groenlandicum, or Skigabuk. Skigabuk, and then if you go a little bit farther north, Galgakebuk, um, which we'll get to why in a minute, but uh, as well as Labrador tea, I sort of wanted to give you the ability to understand everything that I'm saying just through the lens of metabolism medicine, all of those metabolic medicines we use and focus on. So Labrador tea is just the most common and available. Blueberry leaves that have been through a couple frosts are really amazing. And then I guess my next favorite one is possibly the most available of them all is the mixture of asaadi and shingwak bark nigek, where from trembling aspen and white pine. You mix those together, and it's really, really amazing for your metabolism. Also, the Nufar variegata, kundamo, or the yellow pond lily, another really amazing one for your metabolism. And so when I say Labrador tea, I really mean like all of our metabolism medicines. I really want us to have a good understanding of how important these are to give us the ability to get healthy and stay healthy. So here we go. I guess the first thing that I wanted to mention is that everything that we're going to discuss in this video, we're going to talk about immunity, we're going to talk about metabolic disease like diabetes and obesity, we're going to talk about cancer as well. But the most importantly, I'm going to be talking and focusing on like chronic disease, all different chronic diseases like cardiovascular disease and things like this, and inflammatory driven diseases. So everything that ends in itis is a disease that is driven by inflammation. So arthritis, diverticulitis, ulcerative colitis, dermatitis, gingivitis, all of these issues are driven by inflammation. So keep all of those in mind. In order for us to understand everything, we're gonna have to look at like the problem. Labrador tea or all of these metabolic medicines do two things. They really help with inflammation. So all of those different types of inflammatory diseases that I mentioned, that's one way, one mechanism, one reason why these are so important, but also growth. I want us to understand growth and inflammation by the end of this video and how deadly they are. So just to start off with the growth aspect of things, let's look at the problem. One of the problems that we're exposed to is that we're overstimulated by stress, too much adrenaline and cortisol, and this causes too much sugar to be in our blood, as well as we usually have a very glycolytic diet, a diet full of sugar. And what happens when your body has too much sugar in the blood? Insulin brings it down. Insulin is required to bring those blood sugars down. What insulin does is it doesn't just dissolve the sugar that's in your blood, it forces it into only 4 different types of cells in your body will accept the sugar and effectively lower the amount of sugar that's in your blood. Blood sugar is operative only within very narrow parameters. It has to keep that exact, like between 4 and 6 millimolar. Is the acceptable normal range of blood sugar, and so insulin is very sensitive to and effective at forcing the sugar into those 4 types of cells: your kidney cells, your nerve cells, blood vessels, and eyes. Those 4 types of cells the reason why is because sugar is toxic to every cell in your body. Almost every cell in your body has the ability to not let the sugar in or to spit it out once it's there. Those 4 types of cells, mesangial cells, endothelial cells, eyes, nerves, they lack those mechanisms. Once the sugar it's in. And because sugar is toxic, it starts to destroy those cells. This is why if you have any sort of hyperinsulinemic issues like diabetes, where there's so much insulin forcing sugar into all of those cells, you have kidney problems, blood vessel problems, like you don't heal, eye problems, macular degeneration and glaucoma and diabetic retinopathy, and you have neuropathy in your diabetes-induced neuropathy in the diabetes-induced sciatica. So all of those problems is just because of too much sugar and too much insulin. When we have too much sugar in our blood, our body uses insulin to bring the blood sugars down. The problem is that insulin is a hormone, and its main function as a hormone is a growth hormone, and it tells your body to store fat. It tells your body to grow fat, grow the fat cell and fill the fat cell. So insulin tells your body to store fat. Your body only makes fat 5 ways. The number one way, the only way that we're really exposed to, the spare tire way, is insulin. So insulin equals fat, and fat is a recognized endocrine organ. It controls all of the hormones in your body. It has an effect on everything. One of the things that fat does is it makes insulin really weak. When insulin is weak, your blood sugars stay high, so your body needs to make more insulin. When your body makes more insulin, your body will make more fat, and the more fat you have, the weaker insulin is, and you start this hole in the bucket downward spiral of insulin and fat and insulin and fat and insulin and fat, to which your body has a really amazing way to be able to break that cycle. We'll get to that in a second. But one of the things that we have to understand regarding growth, and the reason why Labrador tea, blueberry leaves, chaga, pine, and poplar bark, why all of these metabolic medicines are so important, is because they give your body the ability to require less insulin to function. Generally by probably the most powerful way for every one of them is stimulating the GLUT3 and 4 pathway, your muscles' ability to utilize sugar as energy. Your skeletal muscles are your body's number one mechanism at controlling blood sugar outside of insulin. And so your muscles just gobble up all of the sugar that's there. As you're diabetic, obese, skinny fat, or as you age, glucose uptake goes down. Your muscles lose the ability to utilize sugar. What brings all of the sugars down? Not your muscles, insulin. So driving hyperinsulinemia, driving diabetes, driving obesity, driving all of these other diseases of growth, cardiovascular disease, cancer, inflammatory diseases, all of these things can be, too much insulin is one of the biggest issues. So yeah, we have to understand that insulin is a growth hormone, and bodybuilders will use insulin, sometimes even preferential to the testosterone or the HGH that's out there. They'll just use insulin because it's an extremely powerful growth hormone. You just have to be careful because insulin is anabolic to muscle and anabolic to fat. So if you're not eating the right foods and not conducting your exercise properly, you're going to grow a bunch of fat. Whereas testosterone is anabolic to muscle and catabolic to fat. So it eats away at fat while building muscle. That's why people like it, because you could kind of eat what you want as long as you're on these crazy high amounts of testosterone. Also, it's important to understand too, like cortisol, hormones like cortisol, the stress hormone, is catabolic to muscle, breaks muscle down and builds fat. So if we're stressed and full of insulin, this is just disaster. Excessive growth. What I mean by that, a disease of growth, is like once you're an adult, once you're fully grown, you shouldn't grow anymore. Anytime that you do grow, it's usually bad, other than maybe some muscle. Every time, so gaining fat, cancer is you're growing, cardiovascular disease, even the factors that drive cardiovascular disease can be understood as a disease of growth. Arthritis, of course, extra giant pieces of bone fusing your joints shut. This is excessive growth. Every time you're growing after you're fully grown is bad, unless it's like some muscle. So what drives all of those growth patterns is insulin. And yeah, we just have too much sugar and we have too much insulin. These are huge issues. Obviously, the fastest way that you can deplete the amount of sugar in your body and drop insulin levels so much so that they are immeasurable is by fasting. This is why we fast, first 3 days of every month. And a lot of you guys have been joining in on that, which is pretty fun to hear all of the different results that you have. But after 3 days, why we really chose 3-day fasts every month to be a very powerful tool is because after 3 days, your insulin levels are just like almost immeasurable. You can't even see them. So your body finally has time to see what's going on and to realize, hey, we don't need to be growing all of this stuff. And that period of growth stops. So think of all of those diseases. Think of all of the obesity and the cancer risk that's out there. If insulin levels are just lowered on a regular basis, I think that's going to have a huge impact on the prevalence of these diseases. And one of the reasons why Labrador tea and all these metabolic medicines are so important is because they give your muscles the ability to utilize all of that sugar. So your muscles are glucose gobbling machines, and there's less sugar in your blood for insulin to have to bring down. So your body, in order for it to function properly, only needs tiny little amounts of insulin. Enough to prevent this crazy patterns of growth. So I hope that makes sense. I wonder if I even explained everything properly. But insulin, yeah, it's just such a evil thing that we don't really need too much of, only in very certain circumstances once we're fully grown. The other big thing that I wanted us to be able to understand is that when you're looking at diabetes and the damage that diabetes causes, kidney damage, nerve damage, blood vessel damage, eye damage, a lot of the research right now is focusing on insulin sensitivity. Like there's even a study that I read, I don't even know where it was from. It was just the most bogus, stupid thing where you introduce cells into your body that produce insulin. And that's not helping the problem at all. It was touted like CBC or whatever as the cure for diabetes. And that, I don't know, it's just the stupidest thing, because you're just going to have more insulin driving more sugar inside of those cells, causing more damage a lot faster. So what we're going to see is the sugar, your A1Cs might come back normal. Oh, and we'll remove your diagnosis of diabetes, but you're still going to have kidney problems, nerve problems, blood vessel problems, and glaucoma when you're 30s. So that was the point in all that. It's super annoying. But anyways, the other main thing that I wanted to talk to you guys about is just sort of like an echo of cedar. I just wanted to share with you guys Labrador tea, cedar tea, two most common teas that we have and why we're so obsessed with them. So the Labrador tea works directly with your innate immune system. Your innate immune system is represented largely in part largely because of a relationship between helper cells and killer cells. You have helper cells floating around all over your body, and their job is to put targets on or labels on all of the rogue proteins and viruses and bacteria and fungus and whatever is out there within all of the space in your body. And then the killer cells come behind them and destroy everything that has the targets. So it's a really good relationship. This is what's responsible for helping you get better before you even have an infection, before you're even sick. So you remember in the cedar video, we were talking about how important it is to give your activated immune system everything that it needs to work super fast. So that because when you have an infection, there is inflammation that is incurred and sustained, and every time you have an infection, you have to fight off an infection, all of that inflammation accumulates for the rest of your life. And it is inflammation that drives most chronic diseases. It's inflammation that drives a lot of different types of cancer, and it is inflammation that drives the whole aging process. So if we're giving our body everything that it needs to be able to even deal with the sickness, deal with the pathogen before it even causes an infection, even better. If our innate immune system gets everything that it needs. Actually, the one thing that I really wanted to say is one of the things that we need to realize is that when it comes to just infections like respiratory tract infections or whatever, what determines the severity of that sickness is the initial load of the virus or bacteria. How much of the virus and bacteria actually gets to come in and cause the initial infection. If it's lots, your severity of outcome is going to be quite severe. If it's very little amounts, then it's going to be a very mild case. Now, if your innate immune system is always on and always active and dealing with as much of these pathogens before the infection really sets in, it's really responsible for lowering that initial load as a lot and reducing your severity of outcome. So even if you do get sick, your symptoms are going to be a lot more mild, a lot less severe. And so you think of the effect that Labrador tea or these metabolic medicines is going to have on everything that I mentioned: immunity, metabolic disease like diabetes and obesity, cancer, all those chronic diseases and inflammation and inflammaging, the whole aging process generally. Labrador tea is just so important. There's a reason why we drink it every day. Literally, everyone remembers drinking Labrador tea every single day for your whole life. Certain colonial attempts have been pretty effective at removing these practice from our household, removing this tea from our stove. And then even things like red rose, my favorite example of why we don't drink Labrador tea anymore. If you had red rose, you were fancy and you were rich. You were not in the forest scrounging around for this bush tea. You could buy it. So it turned into the status symbol, red rose and Tetley in some communities. And so everybody had to, have their red rose and throw out the Labrador tea because they had to look rich, which again could just be, another aspect of the colonial conquest and successes. But now, yeah, it's very important for us to say, okay, I'm done growing. I'm done with all this inflammation. I really want to get things back under control. So Labrador tea and all of these metabolism medicines is exactly what we need to stop that pattern of growth, and to stop all these excessive amounts of inflammation and allowing that to, accumulate throughout for the rest of our life and drive the aging process. We don't want to be 50 years old living in a 90-year-old body, or to be we want to be like 80 years old living in a 40-year-old body or a 35-year-old body. So I just wanted to spend a couple minutes with you guys real fast just to share with you guys another, super important thing that I think everybody should understand about Shki and earlier we did Gijgandagabo, the cedar tea. So I'm really thankful to spend some time with you guys, share some of these ideas. So yeah, that's fun. We'll we'll see you guys later.